Hi friends, Dr. Nancy Trimble here. Today we're going to talk about your lumbar disc issues. So as always, we're putting the knowledge and power of your health back in your hands. So just because somebody says, oh, your lower back, you have a slipped disc, a herniated disc, a bulging disc, it is not a death sentence. It is not guaranteed surgery. It is a 1 out of 1,000 chance that you may need surgery. So I've dealt with thousands of disc cases over the years. So I'm going to give you my tips and tricks. First of all, how do you know that you might have a disc problem, a lumbar disc, herniation, bulging disc, or inflamed disc? There is a typical presentation. This is not true for 100% of the people with it, but typical. Typically, you're going to be bent to one side. And this is unconscious. You're not trying to do this. Your body's putting you in this position. It's called antalgia. It's putting you out of pain. You may be not able to straighten up. You may be like this. If you let it go long enough, the muscles of your back will spasm so much you can't move any which way. But if you haven't waited that long, you can usually bend forward with no problem. It's leaning back that is typically the worst. So that's the typical presentation. How does it typically get caused? People will tell me, all I did was bend down and pet the dog. All I did was bend down to pick up a sack. And it's usually a bend with a twist, a slow twist. That's not what started it in that moment. You probably did something in the weeks or months prior that set the stage. And then that one little slow twist with a bend is what let that disc get inflamed or herniated. So what do? First of all, when you come into the office, we are going to make sure you are set up with a lumbar belt. It is a Velcro and elastic thing. We are going to make sure that you have an ice pack that is soft and flexible, because you're going to want to avoid sitting. Sitting puts the most compression on the disc. Actually, let me rephrase that. The most compression or the most pressure on your disc is when you're in this type of bend. We call this a 20-degree bend. When you stop there at 20 degrees, there's the most pressure here. This is the brushing your teeth. For men, shaving your face. For women, washing your face bend. That is going to put the most pressure. The second most pressure is with sitting. So you'll be avoiding sitting. So you're going to keep this lumbar, this lower back brace on 24 hours a day if possible, especially when you're sleeping, because when you sleep you tend to twist. And remember, that slow twist is the worst thing for the disc. This nice, soft, flexible ice pack, you'll use 20 minutes out of every hour, because we have to reduce the inflammation here. You'll put the ice pack between you and the belt, and you can walk around with the ice pack on 20 minutes out of every hour. The other thing we'll do is recommend that you use an anti-inflammatory supplement. Normally we want to use turmeric, and there's some other alternatives to that we'll recommend. There are some medications that are anti-inflammatory as well that will target that disc, but we have to do that to get the inflammation out of the disc and the nerve root area. And as a side note, a lot of people do feel pain into their butt, their hip, their leg, their lower leg, their foot when they have a herniated or slipped disc. How far it goes down your leg is important, but it doesn't change what we're going to do. It's still the same issue. It could be either leg, could be both legs, it might even switch. The other thing, and the reason why I have bacon, lettuce, and tomato with me today is because I will say to you, no BLT. This thing is going to kick your butt for a week or two, this disc herniation or inflamed disc or slipped disc. For 1 to 2 weeks, you're going to have to baby yourself. And the way you're going to baby yourself is no bending, and especially no bending and lifting at the same time. So think a laundry basket like this. No. And especially no bending and twisting at the same time. Remember, this is what can cause the disc to slip. So none of that, no BLT. So I hope that helps. If you have any questions, remember to call us, ask us. We specialize in disc issues. So bye for now. Hi friends, Dr. Nancy Trimble here, putting the power and knowledge of your health back in your hands. So you've been diagnosed by me or somebody else with a herniated disc, a slipped disc, a bulging disc, or an inflamed disc. So there's certain ways you need to rest and lay to take the pressure off of the disc. And by the way, if you're a patient of mine, I recommended probably a lower back brace. I recommended you minimize sitting. I recommended to walk, though. As long as walking does not give you pain, walking is really good. And you want to be on an anti-inflammatory. We recommend an anti-inflammatory supplement based on turmeric. So when you're laying, what you need to do is you need to make sure that you have something that's going to elevate your legs, because you want to decrease the amount of extension in your back. So what you'll do when you lay down is you're going to have either 2 pillows here, or you're going to have 2 cushions. And so notice my legs are elevated, my knees are bent, and I have a good pillow here. So another question I always get is, how do I get out of bed? Because you don't want to just try to wing yourself up anytime, especially if you've got a herniated disc. So what you'll need to do is you'll need to roll onto your side and be very deliberate about this. You want to lay completely on your side. Don't go halfway and then bail out. Completely onto your side. And then you're almost going to be looking at the floor as you push here, and then you sit up using your arms to push up yourself up to a seated position, and then you can stand up from there. Similarly, when you lay down, sit down first, and then you're going to want to lay on your side and then gently roll onto your back and get your legs on top of that pillow. Now, if you get tired of laying like this, another thing that you can do is you can lay on your side, and what you would do then is put the pillow between your knees. What this does, it keeps your pelvis neutral. Some people also like to take a rolled up towel or a small pillow and put that under their waist. So of course this depends on the width of your hips and all of that, but that again will keep your spine neutral, which is super important when you're in that healing phase. So when you're in the healing phase, when we're working on you, which for a lot of people, we're working on you every day at the office, doing adjustments, doing massage, you're going to need to also remember this is going to kick your butt for a good week or two. You need to take it easy. You may need to delegate some things you normally would do, like cleaning, vacuuming, reaching, taking dishes out of the dishwasher is all going to be bad for you. Laundry, not a good thing for you to be doing right now. So, so delegate those tasks, reschedule some things in your life so you can take care of yourself. So you may get tired in the middle of the day, and you might need to just take that pressure off your lower back. So one of the best ways you can do that is just get a chair, and you're going to get yourself onto the ground. Remember, you can still do this in bed too with that, with the double cushion or double pillow under your knees. So you're going to get your legs up on the chair and just relax like that. And just this, what this does, it tractions out your lower back just a little bit to take the pressure off of those nerves to decompress the spine. And just rest like that. When you get up, similarly to when you get up out of bed, you're going to want to put your feet on the ground, and you're going to want to roll to your side. Remember, use your hands to push your body up. Take your time. Be careful. See you next time, putting the power and knowledge of your health back in your hands. Hi friends, Dr. Nancy Trimboli here, putting the power and knowledge of your health back in your hands. Please subscribe. Click the button below. Subscribing is free, and you'll get a notification of any new videos that we post. Today is about simple stretches for severe lower back pain. So if I have diagnosed you with a disc problem, whether it's a herniated disc, a slipped disc, an inflamed disc, these are the stretches that you can do, and you will be able to do these versus other stretches that are more advanced. You can do these stretches on the floor. You can also do these stretches still in bed, laying in bed. And one of the other things you can do in addition to these stretches, if you want to relax, I'm just going to grab this chair. If you want to relax your back, what you can do is put your lower legs onto either a couch or an ottoman. This bend relaxes your back. It actually presses your back to the ground, which will relax the muscles and give just a very slight decompressive stretch to your lower back. So you can do that. You can rest there as long as you want. The only trouble is getting on and off the floor. So if you can't get on and off the floor, I totally understand. You can lay on your bed and then put 2 cushions or big pillows underneath your lower legs to get that 90-degree bend in your legs. So these are the stretches. You're going to do these on your back, and again, you can do these laying on the floor or laying in bed. And you first are going to bend your knees so your feet are flat. You'll take one knee and bring it to your chest. This is easy to do unless you have knee problems, and then you can grasp behind your thigh. You're going to press and hold your knee into your chest. Hold it for 30 seconds. Breathe deeply, and you should feel a stretch in your lower back. This will be easy to do if you have a disc problem. After you do that one, you grab the other one. Again, 30 seconds. It's just a stretch, so breathe deeply and relax. When you're done with that, both knees together, bring them into your chest, really squeeze them in, and you'll get even more of a stretch in your lower back. When you're done with that, the next thing you can do is you can try the pelvic tilt, which means you're going to tilt your pelvis, and so you're pulling your pubic bone towards your rib cage. You're pressing your navel to the bed or to the ground, and this will create a pull or a stretch in your lower back. It's also a mini abdominal exercise. You hold that for a few seconds and relax it. So you should feel the small of your back flatten to the ground. If you're having trouble, you can take your hands and put them under your butt, and that will kind of create that same flexion of your spine. So you can, if you're having trouble moving your pelvis that way, just put your hands under your butt and try it again. So again, relax. You can do these stretches as often as you want. These stretches are designed to put a little bit of traction in your lower back. As a side note, there is a type of exercise called the McKenzie method where there's hyperextension of the lower back, where you're really leaning backwards. I don't recommend that for my patients unless I specifically tell you to do it. So if somebody tells you to do that, just say, hey, my chiropractor said I should stick to these other exercises. And because what we're doing with you is decompressing the disc of your lower back, and that is needed most often, 99.999% of the time, with your back in what's called flexion. And that's what these exercises do. So if you have any questions, of course, ask me. As always, putting the power and knowledge of your health back in your hands. Bye for now.